Welcome back to Coffee and Clarity, Preventing Substance Misuse. I'm Michelle.
And I'm Reyna. Today we are excited to have Dr. Jason Kilmer with us. Dr. Kilmer is a professor at the University of Washington and has spent years researching and working on prevention efforts for college students around alcohol and marijuana and other substances. He's worked on a range of student groups and has received numerous awards for his work with prevention.
In today's episode, we'll be discussing the similarities and differences between the prevention work we do with younger students and the strategies Dr. Kilmer uses with college students. Dr. Kilmer, thanks so much for being here today. To start off, can you tell us a little bit about yourself and what first got you interested in working with college students on substance use prevention?
Sure. And thank you for the opportunity to join you today. Thanks for the impact you have and your classmates and your community. It's awesome. Prevention's a great field, and I'm honored to get to be on your podcast today. As you heard, I'm Jason Kilmer. I work at the University of Washington, both in a research capacity and also directly doing work with students. And the bulk of my career, the research has been around college student alcohol use, cannabis or marijuana use, other drug use, but I think importantly, approaches to how we work with students on those issues. No one ever asks me how I got into this, so I appreciate that you asked that question. I knew I loved psychology, and I knew I loved math. And when I was a first-year student in college, my goal was to be a double major in math and psychology, because I thought if I could use psychology to motivate people about math, I'd be the greatest math teacher ever. My heart was in the right place. I learned that wasn't super helpful necessarily. But when I started taking math courses, I learned how engineering-focused they were. And once I got into psychology, I loved it. And when I learned that so much of it is science-based and there's so many statistics, I realized that my love of math could be met through all those statistical analyses. And so I was really sold on psychology. I got into the addictive behaviors field when our field has really grown a lot. Research on prevention efforts with college students weren't showing a lot of successes. People might have learned things when they went through a program, but they weren't changing behaviors. So there was a researcher that I had the chance to work with who said, I'm looking at alternatives to what's been out there forever. And the rest is history. I've been able to do research around prevention ever since that point.
College students to help prevent alcohol and marijuana and drug use. What are some of the biggest challenges students face when it comes to substance use?
I feel like I could talk about that for an hour, and I know that's not what I'm supposed to do, so I will try and answer that briefly. And honestly, if you're willing, I'd even like to hear what kind of challenges you run into with the students you work with. I think there's a number of challenges. I think that there are big misperceived norms. I mean, you probably hear this with the students you work with, where people say, well, everyone drinks or everyone uses weed. They really, really, really don't. We can see this from so many national data sets that there are these big misperceptions. And if people think, yeah, but most people do use, they might be more likely to start. And if you can correct a misperceived norm, it might have those people that are currently not using, it might result in them continuing to abstain, to continue to not use. So I think one of the challenges people face are those misperceptions. If someone says, I really don't want to drink in college, then don't. Like, you will be supported in that decision to not drink. I think one of the other challenges is that people hear a lot about, look at alcohol, for example, about all the amazing things that will happen if they drink. If I drink, I'll be more funny, I'll be more outgoing, I'll be more talkative, I'll be less shy. The research shows it's not coming from the alcohol. It's that belief or that expectation more than the substance itself. So those are just two examples. I could keep going on, but I think that there are a lot of things that are misperceptions, and it's why people like you, people that work in prevention, can be so important in correcting those. What would you say? What are some of the challenges you run into?
We definitely run into a lot of students feeling the need to do it because they are seeing their friends and they're seeing adults around them do it, and they're like, wow, I want to be just like them. And like you said, be outgoing, be courageous and whatnot when they do or drink alcohol or smoke marijuana or something like that.
Yeah, I would agree with that.
All right. And how is prevention on college campuses different from prevention in high schools or middle schools?
That's a great question. I mean, you obviously are the experts on middle school and high school. I think that One of the things about college is while the demographics of any one school can certainly vary, for the most part, the students I work with are 18 to 25-ish. So you've got students that are underage and it's illegal, 18, 19, 20-year-olds, but you've got people for whom it is legal for them to drink, 21 and older. And so I think one of the big differences is that we still make clear if you're under 21, it's illegal. And if someone says, I want to avoid all of alcohol's unwanted effects, choosing to not drink is the best way to do that. But especially if people are making the choice to drink or they're about to turn 21, we try and provide the information so that if they make the choice to drink, they can do it in a less dangerous or less risky way.
Yeah.
Our youth group does peer-to-peer education with younger students in elementary and junior high schools. Do you think a similar model would work with college students around alcohol and drugs?
Peers are very, very powerful. And there's decades of research that shows that what people think their peers do, think, and feel influences what they think and do and feel. And, I said at the beginning how grateful I am for the role you play for your classmates. There's research that shows that even when you account for what people think the typical student or most students do, what they think student leaders think, do, and feel, what they perceive that you do and believe and feel, actually can influence their behavior even more. So there is research that looks at on college campuses the role of very meaningful, influential student leaders. People in residence life, there's RAs, resident advisors, that are their student leaders, captains and assistants on sports teams, peer health educators. They can be very, very effective as part of an overall strategic plan for prevention. And a lot of colleges do include the role of peers as part of that prevention puzzle.
What are some similarities and differences between the peer pressure students face in middle school or high school and what college students are experiencing?
Another great question. You ask really great questions. I mean, there's some that are fairly similar. The person that doesn't want to drink and is feeling like, well, isn't everyone going to expect me to? I can't stress enough that it's not the case that, quote, everyone drinks. Knowing we were going to be meeting today, I took a look at some of the best national data we have. And at the University of Michigan, the Monitoring the Future study collects data from 8th graders, 10th graders, 12th graders, college students, and young adults not in college. If you look at past year drinking, even high school seniors, the oldest of the high school group, 41.7% say that at least once in the past year they drink. So what does that mean? 58.3% don't. The majority do not drink. So if someone says, I really want to fit in, choosing to not drink is actually the choice that's allowing you to fit in. On college campuses, I'll say again, there are students for whom drinking is legal. But I think about what gets portrayed on every movie about college or every TV show or even social media posts. It's like the crazy party. That's not what most people are doing. When we look at college campuses, they ask people, how often have you had 5 or more drinks, at least once in the past 2 weeks? 22% of college students say at least once. So think of the flip side. 78% of students either don't drink at all, or if they make the choice to drink, have 1, 2, 3, or at the most 4. We really want people to know that if you say tonight, I really don't want to drink, then don't. You've made the choice that many of your classmates have made. So that's where there are those similarities. There are, again, those misperceived norms. The difference, of course, is that the older you get, the more some of those norms change, and we have to be very mindful of the misperception. One of the other big differences, and I mentioned this earlier, is that some of the students we work with are legal, are above the legal age, and so if their decision to use, that can be something where it's very pronounced as a difference as well.
You've worked with frats and sororities, which can influence students on campus. How can we make choosing not to drink or use drugs like the normal choice?
Well, I hope what you just heard is that depending on the age group you look like, that is the norm. When it comes to alcohol, you did hear me say that most students either don't drink at all, or if they make the choice to drink, it's a lower amount. I looked at that for college students. When they ask, how often have you had alcohol in the past 30 days, the past month? 55% of college students say at least once. 45 don't. So it's almost a 50-50 split on college campuses between those that don't drink and those that do in a typical month. When it comes to other drug use, the overwhelming majority do not use. So what is the norm? Is the norm is not using. And so I appreciate that question. Like, how do we make the norm non-use? It is the norm. And the bigger question is, how do we make sure people know that, believe it? How do we put a spotlight on that? And I think that peers can play a part of that. Other prevention efforts can play a part of that. But that's obviously what we all try and do.
Our youth group focuses on empowering students to lead prevention efforts. How do you encourage college students, especially student leaders, to step up and take charge of prevention on campus?
Well, I think you heard me say that it's important for peers to be a piece of the overall prevention puzzle. Part of it is just knowing where to go and knowing where to look. Most college campuses do have like a peer health educator team, a peer health educator group. I know that people that were like, I love doing this in high school. I hope I can still do it in college. They can. And so it's finding where that might be. It might be a health and wellness office. It might be a health promotion office. In some schools, it's in their health center. It's just knowing where to look. But for the most part, they all are called peer health or peer education. There are entire national conferences once you reach college dedicated to the power of peers and the role that peers can play in the health of their classmates. So especially if you in 8th and 9th grade say, I still want to do this 4, 5, 6, 7 years from now, you absolutely can in a college setting.
How do you know if prevention efforts, hold on. How do you know if prevention efforts on a college campus are working? What signs show that things are improving?
We collect data. It's all about truly trying to see if our goal was to reduce blank, did blank go down? So it's all a matter of testing, having measurable hypotheses, measurable outcomes that we can actually test. So it's interesting that sometimes data might look like they're moving in the wrong direction, but it's because we've done our job. We've made sure that, for example, if people want to recognize the signs of when someone has used too much, when do you call for help? If we've really done our job, at least initially, calls for help might increase a bit because people now know what to do if there's a potential emergency. But in a lot of our research, we will collect surveys from people before they even start a program, a prevention program, and then we'll collect data afterwards. Importantly, we also include, if we're doing research, a control group. It's someone that didn't get the prevention program, didn't get the intervention content, because we want to know what happened with that group. So if our group saw a little bit of reduction, but the control group actually saw an increase in a behavior, then wow, our prevention program really, really, really had an impact. So it's essential that we measure outcomes, and it's really, really important to measure those outcomes in the context of what's everyone else doing that maybe didn't get a program, an intervention, something like that.
And here at Mix Up, we focus on making sure students feel comfortable talking about prevention without feeling judged. How does stigma affect college students, and how can it be reduced?
So amazing that you asked that question, and I wish more people asked that question. When we look at lots of research, Bill Miller and Steve Rolnick are people that developed an approach called motivational interviewing. And when they look at predictors of change, one of the things that gets in the way of change is when people feel judged, when people feel defensive, when people get resistant. And one of the ways we can reduce resistance is precisely what you said. It's being mindful of lessening stigma. And so I think we talk a lot about the importance of people first language. What does that mean? We don't talk about drinkers and non-drinkers. That makes it sound like it's, the people that do this versus the people that don't. We talk about people that make the choice to drink. We don't use words like alcoholic in quotes or addict. If someone uses it themselves to describe themselves, there can even be challenges for them with that. But we do what we can to avoid labels, to avoid judgment, and to really make sure that we're just being as respectful as we can in the way we talk about things. So I applaud you for that and that question. And I will just say it's more than just around alcohol and other drug use. We do it with mental health too. It's okay to ask for help. It's okay for things to not feel okay. And to say to someone, I feel like I want to talk to somebody. And so the more that people feel comfortable seeking help when they feel like it would be useful, the more you're actually going to see services get utilized.
We work on preventing substance use before it becomes a problem in high school. How do you approach college students who may already be struggling, and what is the best way to help them?
What a great question again. We do a lot to support health and counseling centers in screening. So, in other words, if someone's having a tough time, how might we reduce the likelihood of them, in quotes, slipping through the cracks? So maybe someone isn't necessarily thinking about their marijuana use or their alcohol use, but they do want to go to a healthcare provider to get a flu shot or to, can you look at this thing in my throat or whatever it might be. And so, when we go to the doctor, there are questions that we're used to getting asked. And increasingly, at least on college campuses, we're doing what we can to make sure that people know they're probably going to talk about their drinking, if they use other substances, their other substance use with their healthcare provider. Then, if it does look like someone's having a tough time, if they seem like they're more at risk for things happening down the road, there's the opportunity to offer, the chance to talk to someone about that, get them connected with services if they want, or so on. So I think the other piece of that, though, is making sure people know where to go if they do want help. I don't know if you run into this at all, but I know that in the work we do around marijuana use, one of the things we know is that it's a very addictive substance. But too often we hear people say, well, my friend said it's not addictive, or I saw on social media that it's not addictive. It is very addictive. But imagine if you're struggling and all you keep hearing around you is, but it's not addictive. You're probably not going to ask for help because people around you are telling you it's a non-addictive substance. The more we can clear up some of those misperceptions about the addictive potential of certain substances, the more that when people are experiencing challenges, they'll know to ask for help. I'll give you one last example. Marijuana use, cannabis is very addictive, and there's even withdrawal symptoms when people stop. It's amazing when you look at those withdrawal symptoms, how often they are the things that people say, well, that's why I use weed. So I'll give you an example. I have a colleague that did a study with incoming first-year students, and she asked them, tell us why you use marijuana. And they said things like, I like getting high, I like the feeling, it gives me something to do with my friends, helps when I'm bored, music sounds better, it's cool, it helps me celebrate. But they also said it helps when I'm depressed, helps when I have anxiety, helps if my appetite stinks, helps if I have a headache, helps if I can't sleep, lets me relax. What are the criteria for cannabis withdrawal? They include anxiety, depressed mood, struggles with appetite, headaches, and difficulty with sleep. So if someone says, well, I feel like it helps my anxiety, and you ask them, well, how do you know? If they say, well, I use weed every day, and last week I ran out and I didn't use for 2 days, and my anxiety was terrible. I had a headache, I couldn't sleep, I got my hands on weed again, and all of it got better. See, so it helps my anxiety. That's not cannabis helping anxiety. That's resuming use, making withdrawal symptoms stop. And that is a case of a person potentially being addicted. So, long-winded way of saying, we really want to make sure that people are even connecting those dots. If someone notices that when they stop, they get anxious, they get down, their appetite's not the same, they can't sleep, that actually might be a sign that they may want to talk to someone about how to make changes in their behavior.
What have you learned from the work you have done that could help with prevention efforts in high schools or communities?
The most important thing is that any one thing we do is piece of an overall puzzle. If a school or a community does a social norms campaign, that's awesome. It's a piece of an overall strategic plan. So you want a mix of strategies, and that mix of strategies includes, policies, but then enforcement of those policies. It includes education, including but not limited to the role that peer health educators play. It includes prevention, it includes intervention. When people need treatment, it includes treatment. And then it includes recovery support. So I think the most important lesson learned is we can't just do one thing. It has to be a mix of strategies. And our field really has grown a lot. There are very effective strategies that can be included as part of a mix.
A lot of prevention messaging focuses on the risks of substance use. How could you balance talking about the risks while also encouraging students to make positive and healthy choices?
It's a really important question because, the people that we work with, people know themselves best. They're their best experts on themselves. And so when we have all this amazing science, it's like, yeah, but I know me. So we can always start by even asking people, what are the good things about the substance for you? What are the things you like? They will tell you. What are the not so good things? That's a very different question than, what negative consequences have you had or what problems have you had? Because again, we're trying to lessen stigma. We don't want to label something as a problem. But if we ask about the good things and the not so good things, I've literally never met someone who said, well, there are no not so good things. There are. They know what they are. So you're right. We don't just want to be bad news, bad news, bad news, bad news. We want to ask people, what are the things you like about this? What are the things you don't like as much? If there are those things they don't like so much, and that can actually be reduced or eliminated completely by making a change in their behavior, we can explore that with them. And I think the key then becomes, how does someone take what they perceived as the good thing associated with substance use for them? If they're choosing to no longer use substances, what are some healthy, substance-free ways to achieve those? In other words, if someone says, well, I know that it's addictive, I know it doesn't make me feel great, I definitely don't feel good the next day, but it relaxes me. If someone decides, I'm going to quit using, it's important to explore, well, what are you going to do to relax that doesn't involve substances? So I think that the other part to answering your question, seriously, all of your questions are so good, you could fill an entire 10-week class on these questions. I think that the other part of it is making sure that people have coping strategies or have ways to achieve what they perceived to be the positives associated with substance use for them.
And finally, what advice would you give to high school students who want to keep doing prevention work when they get to college?
That this field is awesome, that you're awesome for even asking that question, and that this is totally worth pursuing. Public health is important. Data matters, science matters, and we have such great science surrounding prevention in this field. So if you're in high school saying, I'm interested in this, you heard me say at the beginning, you can always change majors when you get to college. But if you say, I want to be able to keep doing prevention, there are entire fields, psychology, which is what my PhD is in, is clinical psychology, public health. There are entire fields of study that would let you keep doing this professionally. But even if you're like, I don't really want to do it professionally, but I do want to keep helping people, things like peer health educators are definitely something you can get connected with. Keep in mind, too, that there are a lot of campuses that have campus community coalitions. And what that means is it's people from the campus and people from the community working side by side. And so especially if you wind up going to college near where you were also a high school student, you might even be able to keep some of those relationships you put in motion, allow them to keep going. So it's an awesome question. It's a fantastic field. And I'll end by what I said at the beginning. Thank you for doing the work that you do for your classmates. It matters in a big way. And if you say, I want to keep doing it when I get to college, you have a lot of people that would happily work alongside of you as partners in prevention.
Thank you so much, Dr. Kilmer, for talking with us today. It's been great learning about the challenges and opportunities in substance use prevention, both at college level and in our communities.
And to our listeners, we hope you found this conversation inspiring and are thinking about how you can make a positive impact in your own schools and communities. Remember, you have the power to lead change, no matter where you are. Until next time, thanks for turning to Coffee and Clarity, Preventing Substance Misuse.